In a clinical setting, CRP only tells you one thing, that inflammation is present. It does not tell you the exact cause. C-reactive protein, or CRP, is a marker of inflammation that rises quickly in response to a trigger and can also drop quickly once the trigger improves. That's why clinically, CRP is most useful as a trend marker. One CRP value is just a snapshot, but two values over time show a direction. If CRP is rising, it suggests there is an ongoing trigger or the situation is worsening. If CRP is falling, it usually suggests improvement or response to treatment. CRP is an acute-phase protein as part of the body's innate immune response to inflammation or tissue injury, part of body's cleanup response. It can increase in response to many different stimuli, for example, infection, both bacterial and viral, tissue damage, trauma, surgery, autoimmune flares, ischemia, and several other inflammatory conditions. So how exactly is it produced? When inflammation happens somewhere in the body, immune cells at the site, especially macrophages and monocytes, release pro-inflammatory cytokines. The main cytokine that drives CRP production is interleukin-6. Interleukin-1β and TNF-α also contribute. These cytokines enter the bloodstream and reach the liver, where they act on hepatocytes. Once interleukin-6 binds to its receptor on hepatocytes, it activates an intracellular pathway, mainly the JAK-STAT pathway, especially STAT3, which switches on CRP gene expression. As a result, CRP is produced and released into the bloodstream, and during significant inflammation, its levels can rise quickly and become quite high. CRP is part of the body's immune activation. As we already said, it's a part of a cleanup response. It can bind to molecules such as phosphocholine on microbes and on damaged cells. This helps CRP act as an opsonin, meaning it marks targets for easier phagocytosis. It can also activate the classical complement pathway through C1q. The clinical takeaway is that CRP is not a diagnosis, it's a signal. We have to use it together with clinical picture, and most importantly, we have to use it as a trend over time.